In the arid lands of Marsabit County, silence often hides the struggles of young mothers. In areas like Merile and Laisamis, behind the smiles of the families and their daily struggle, lies a quiet revolution, one driven by women who've decided to reclaim control over their bodies and their futures. They are young, determined, and sometimes defiant, some sneaking out of their homes to attend mentorship meetings that are more than lessons but pure sanctuaries. Here, they learn about nutrition, family planning, and safe motherhood in efforts to protect their right to the highest attainable standard on reproductive health care, as stipulated in Article 43(1)(a) of Kenya's Constitution 2010. At Merile, where the Rendile is the predominant community, the topic of family planning remains a taboo. Tradition dictates that men decide how many children a woman should bear, with large families perceived as a mark of pride and power. For women, questioning that tradition means facing stigma, rejection, or even violence. The situation is compounded by myths and misconceptions, including claims that contraception causes infertility and that empowered women become arrogant or unfaithful. This keeps many women trapped between cultural obedience and personal freedom. But in this tide of silence, new voices are rising. Across Marsabit County, a total of 282 mentorship groups are quietly transforming thousands of women's lives, providing safe spaces for young mothers to learn, share, and heal. Kaltum Aligele, a 26-year-old mother of one, is among the young women breaking the silence and who is now fully in charge of her reproductive health.
Kitambo kabla tujajua maana family planning, tulikuwa tunapitia mingi, yani tunazaza ovyo ovyo. Sasa hivi tumefunzwa maana family planning, at least tunajiweka poa, imetufunza mingi, at least yani watoto wakue uzae mwingine akiwa na 5 years, at least ukae tena 3 years ingine ndo uzae mwingine tena. Na kitambo tulikuwa tunajua yote, tulikuwa tunazaa tu, mwingine kuna months tunazaa sasa hiyo tena, wakati mwingine kuna 6 months ndio yuko pregnant, hatukuwa tunajua. Tumefunzwa venye unaenda clinic, mtoto ukizaa pia ukijifungua, venye ya kulea mtoto.
Family planning tumefunzwa jinsi ya kutumia hizo masindano yote, aina yote, na hata tumefunza jinsi ya usafi, nutrition, chakula yenye mama anapaswa kula.
Kupitia hiyo masomo tumeweza imesaidia sana katika community na jamii nzima, kwa sababu tumeweza kupunguza wale watoto ambao walikuwa malnourished, kwa sababu tulikuwa tunafundisha watoto wa mama jinsi ambayo wanakula na vile wananyonyesha na pia vile watoto wanafaa kulishwa.
She says through these sessions, they encourage and support each other, and that many had embraced family planning for the first time and invested in saving groups, enabling them to pool their resources to start small businesses and pay school fees for their children.
Masikopo ametufunza mambo na savings, ya kusave pesa. Tumesave pesa, lakini imetusaidia. Sasa tumeanza project ya kuuza mbuzi. Sasa tuko na kama wiki 3 tukianza biashara, lakini imetusaidia sana juu tunapata kila soko profit. Tuna save 100 kwa sanduku. Tuko na 2020 ya hiyo social fund, halafu 50-50 ya merry-go-round. Hiyo pesa ya merry-go-round tuna every Thursday tunakaa chini, tunatoa hiyo 50-50. Leo tunauliza mwenzetu mmoja, unataka kusaidika nini? Tunanunulia kama ni chakula, ukitaka vitu ya nyumba tunanunulia. Kitambo unajua tuko kuna wenye walisoma, mabwana yao wanajua maana ya group ni nini, na kuna wengi wetu hawajasoma.
mabwana yao wako na shida, lakini baada wamekuja kujua hii kitu inakuja kutusaidia, hawana shida yoyote. Sasa kama unataka pesa ya kukimbia hospitali upate any emergency au na nini, lakini tangu tupate mambo na nini, tupate group tuanze kusomeshwa, sasa maisha imekuwa sawa.
From fear to freedom, these women are rewriting their stories, one meeting at a time. A new youth-friendly unit at Laisami Sub-County Hospital, established through a partnership between Mercy Corps and the county government of Marsabit, has become a symbol of dignity and hope by offering family planning, postpartum care, and HIV counseling privately, respectively, and free from stigma.
When Mercy Corps came here, they came and asked us about the challenges that we have as a hospital in providing SRH services. And therefore, one of the gaps we identified was how the youth-friendly services could be available in this facility. And therefore, we went into partnership, and Mercy Corps came in, and they did some good job by providing equipments, furnitures for the room that we were using for youth-friendly services. And now we're able to provide these services to the young people, young mothers, teenagers mothers who come to this facility, and they're afraid of seeking services because of maybe long hours, waiting in the queues, maybe stigma from both the community and the healthcare workers who look at you in a different eye, that this is a young person. How come that she requires these family planning services? How come she needs a depot? How come she needs to plan these pregnancies? But courtesy of this organization and the hospital at large, the community health unit, we're able to sensitize and talk to young people, and by the fact that there is a place where they could walk in and get these services without interruption. This has really improved the uptake of family planning services.
Every week, at least 10 young girls, some as young as 15 years, visit the clinic accompanied by their mothers.
Since we got the partnership with Masco, the services of youth-friendly services have improved, since we have a room where they can openly come and meet people there and then be open and we discuss their issues. Another thing is that since we had that cooperation with Masco, the number of youth who are coming to seek services have increased. In a week, I can say we get around 7. Yeah, in a week we will get around 7 youths who come for services like family planning and other services like HIV testing. Some come for counseling. Even their parents bring some who are drug addicts for counseling. Majority of the youths who come, specifically they come for family planning, and others come for ANC clinics, those who got pregnant at teenage. Yeah, those are the services those are the ones who are coming at high numbers. When they come specifically for family planning, they are not specific on the method they want to use. They just come and then they seek advice from us. So we counsel them on all the methods, and then they choose whichever method they feel that it is preferable for them. Yeah. Also those girls who are in school and their parents bring them for family planning. When you ask the reason why, the parent explained that she's seeing that her daughter is having a relationship and she has been maybe talking to her and she's not changing her behavior. So the mother chooses that she use family planning in order for her to avoid getting pregnant at early age.
Health experts say family planning isn't just about limiting births, but saving lives and expanding choices. The World Health Organization says contraception is key to reducing maternal deaths and enabling women to pursue education and economic stability. From chiefs to senior administrators, local leaders are beginning to rally behind the call for change.
Family planning ikiwa ndo mama ako na time yake kama hiyo mwaka 2, achunge boma, achunge mzee, angarisha boma kabla tena apate mimba ingine, ianze sasa kumweka achoke, boma itaanza kurudi nyuma. Lakini tufikirie sana mambo ya family planning, itatusaidia kijamii kupanga maisha yetu mbele. tofauti, akuwe kwa family planning ama asikue. Akitaka kuwa mkora bado atakuwa mkora.
So ukipanga familia upange at least uwe na watoto wachache, unaweza kuwashughulikia kwa masomo, kwa mahali ya chakula, lakini wakiwa wengi hapo pia watoto wengi watakuwa na njaa, utaweza kuwalisha, na wengi pia wanaweza kupotea kufanya kazi zingine kwa vijiji kama pengine child labor. Utakuta pia early marriages sababu ya shida ya maisha ile ambayo wanapitia, lakini wakipanga uzazi wakuwe na watoto pia family wataweza kujimudu kimaisha na wapeleke watoto wao shule.
Mercy Corps official Fatuma Ismail says the mentorship program is reshaping attitudes and saving the futures of the young mothers.
Prime is being implemented in 2 counties, that is Isiolo and Marsabit. So largely what we do mentorship in their safe space, where we give mentorship to the young girls and young mothers. So we do several trainings, that is in business and basic literacy and numeracy for those who have never been into school. We also do capacity building in SRHR. So majorly is we want the young girls to be confident, to be heard, for them to make their own decision so that they can secure their household income and income activities. So when we do mentorship, it's kind of like we want the participants to identify themselves, to make the decision making, and to at least be resilient in their households where they can start a small businesses. And also some of the girls, you can find that maybe young girls who dropped out from school, maybe from different challenges, they start saying that maybe they can go back to school and they can start where they left. And others are like they are already mothers and already wives at a young age, but still they are like, we cannot go back to school. So what we do basically is we train them on business literacy so that they can start some few businesses. And the other thing we do is a saving culture, where we teach them how to save. That is we practice silk methodology. So where they save a small amount, like a 20 shillings, 100 shillings, where they can put together and then they can borrow from each other. The safe space is where they can give support to each other. You'll find that maybe and they listen to each other, give support to each other, and make a decision. So what happens is you'll find that a 15-year-old girl who is a mother of 2, married to an old man who has 4 wives. So basically she has that trauma. But when she comes to the safe space, that is where she gets some people who can hear her. Maybe she can get some who has the same experience as her, and then maybe they can change stories, and then she'll have that confidence to know what she wants in life. The girls or the participant or the youth are being trained by the CHPs, that is community health promoters, where they act as a link between the girls and the health facilities. Why do we do that? Because we have some topics on sexual reproductive health.
For the women across Marsabit County, family planning is no longer just a health choice, but a fight for dignity and survival. It is about ensuring that every child born can be fed, educated, and loved, and that every woman can dream without fear. But until men are fully roped into this conversation and cultural taboos are broken, many women will continue to live in secrecy, sneaking into mentorship meetings, hiding contraceptive implants, and quietly fighting for their freedom. Till a change has begun. The women are standing taller, speaking louder, and proving that their right to protection and choices and to be free from stigma and silence must be preserved no matter the cost.